Hi guys, it's me, Kim, as you can see. So clearly I'm not there, I'm away. So I decided to go ahead and just record my part so my peers wouldn't have to do it and feel overwhelmed. So let's just get started. So if they haven't already said already, we're covering cirrhosis. So I'm going to talk about the pathophysiology portion and the clinical manifestations behind that. So to begin with the pathophysiology, so cirrhosis is defined as that end stage of liver disease. So the most common causes of cirrhosis are your alcohol-induced liver disease and chronic hepatitis C. So in some cases of nutrition-related cirrhosis, you result in like extreme dieting, obesity, malabsorption, things like that. However, it's important to keep in mind that environmental factors and genetic predisposition can still put you at risk for cirrhosis, even without the dietary or alcohol intake. So, chronic inflammation and cell necrosis from viral hepatitis can result in that progressive fibrosis and ultimately into cirrhosis. So, in cirrhosis, the liver cells, they attempt to regenerate, but in that regenerative process, they're coming back abnormal. So then you have like those abnormal blood vessels, the bile ducts out of whack, things of that nature. Eventually, the irregular and disorganized liver regeneration, poor cellular nutrition, and hypoxia result in that decreased liver function. Okay, so with clinical manifestations, you have your early and you have your late signs. So generally with early, you're going to have really few symptoms, if any. Patients during this stage will generally not even know they have a liver disease because it's really just characterized as fatigue. And it isn't until proper diagnosis that you see that hepatomegaly. So going into the later signs, there's a whole array of them. You have your jaundice, your peripheral edema, ascites, and then you go down towards so let me go back a little bit. So with jaundice, that is that it results from that decreased ability to excrete bilirubin in the small intestine. And then going down to like the skin lesions, you have two main types that correlate with cirrhosis. They're called spider angioma and palmar erythema. So with spider angioma, you have like that small dilated blood vessel with that bright red center, and it has spider-like branches. So generally it occurs around the nose, the cheeks, the trunk, the shoulders, the neck, things like that. Then you have your palmar erythema, and it's a red area that blanches with pressure, and generally you can see it on the palmar parts of the hands. So moving down, you have your hematological disorders. So you have thrombocytopenia, leukopenia, coagulation disorders, and usually that happens because the liver's inability to produce prothrombin now. So you have like gingival bleeding, you have the nosebleed, purpura, petechiae, things of that nature. Then also your anemia, which is caused by poor diet, poor absorption of folic acid, and bleeding from varices. So with endocrine disturbances, you have both affected for men and women. So for men, you have that gynecostomia, impotence with loss of libido, loss of pubic and axillary hair. And then for women, for young women in particular, you have that amenorrhea, and then for older women, you have that vaginal bleeding. And then last, with peripheral neuropathy, you see this mainly in alcohol-induced cirrhosis, and generally that's because of that dietary deficiency of folic acid, cobalamin, and thiamine. Thank you.